It's really important for our government at all levels, from local to federal, to really understand and represent its constituents. I think one of the challenges for the Asian American, Native Hawaiian, and Pacific Islander community is that our needs are often not understood, perhaps because we suffer from the model minority myth, which is the myth that on average our community is doing well financially or education-wise, but that really obscures the real needs that a lot of our communities have. And it's up to us in the advocacy community to speak up and make sure that our elected officials understand what our concerns and priorities are and how they can be met. I think that in addition to our general priorities and concerns, from healthcare to housing to the economy, jobs, education, there's a really growing concern around people's safety. The fact that 11% of undocumented immigrants are Asian American, really they're concerned that their families are going to be torn apart. They're concerned that they're going to be deported to countries that they've never known. When you have a rise in hate crimes against the South Asian, Muslim, Arab American, Sikh, Middle Eastern communities, there's a real fear, a real concern that's being driven by this political climate, and not just by the policies that are proposed, but really the rhetoric that's being directed toward our communities and immigrants in general. People who have those concerns around immigrants and refugees really are ignoring the history of our country. Our country was built in large part by immigrants and refugees, and they're ignoring the tremendous contributions that these communities, our communities, make every day. And this is especially important for the Asian American community, in which 2/3 of the Asian American community is itself immigrants, and as a total 90% of Asian Americans are themselves immigrants or the children of immigrants. This is our community they're talking about, and so we take it personally. We have a lot at stake, we have a lot to share, and we have a lot that we've already contributed to this country, and I think they need to understand that. Community health centers are incredibly important, and in particular for the Asian American, Native Hawaiian, and Pacific Islander communities. When our communities are 1/3 limited English proficient, when we are almost 2/3 or 3/4 immigrants, there's a great need for community health centers to really be able to reach out in a language that our communities literally can understand, but also it goes beyond just translating materials. It goes into cultural competency. It's about understanding the cultural barriers, the cultural sensitivities that our different communities face, and it's about making sure that we have the information. And the great thing about community health centers having the background in our communities is they understand the different health disparities that our communities face. And that's where I think community health centers play a vital role in stepping in and really provide treatment and literally save the lives of a lot of Asian Americans and Pacific Islanders. One of the important things that AAPCHO and community health centers can do is making sure that all of the people that they treat understand their rights and understand their opportunities to engage in the civic process, to register to vote, that they remember to vote, that when you show up at a community health center or when you show up at a housing clinic or you show up anywhere within our communities, that you're reminded that we have a great opportunity and really a responsibility to engage civically. And so as community health centers provide care and treatment to its patients, it's the people that they serve also have the responsibility and the reminder that they need to do their part as well and to really engage in our community and in our government.